A bone marrow transplant, BMT, also known as a stem cell transplant, is a medical procedure that replaces damaged or diseased bone marrow with healthy stem cells. These stem cells, which are located in the bone marrow, are the building blocks for all blood cells, including red blood cells, which carry oxygen, white blood cells, which fight infection, and platelets, which help blood clot. The goal of a BMT is to restore the body's ability to produce healthy blood cells. Why is a bone marrow transplant needed? BMTs are used to treat a variety of conditions, including cancer, leukemias, lymphomas, multiple myeloma, and some solid tumors. Blood and immune disorders, aplastic anemia, immune deficiency disorders. Autoimmune diseases, certain autoimmune disorders where the body's immune system attacks its own tissues. Conditions where bone marrow is not producing enough blood cells. Myelodysplastic syndromes, myelofibrosis, and other conditions. Types of bone marrow transplants. There are two main types of bone marrow transplants. 1. Autologous transplant. This type uses the patient's own stem cells, which are collected and then reinfused after the patient has received chemotherapy or radiation therapy to eliminate the unhealthy bone marrow. 2. Allogeneic transplant. This type uses stem cells from a healthy donor, who is usually a family member, but can also be an unrelated donor. The donor's stem cells must be a close match to the patient's to minimize the risk of rejection. The procedure. 1. Preparation. The patient may receive chemotherapy or radiation therapy to eliminate unhealthy bone marrow cells. 2. Stem cell collection. Stem cells are collected from the patient, autologous transplant, or a donor, allogeneic transplant. Third infusion. The collected stem cells are infused into the patient's vein, where they travel to the bone marrow and begin to produce healthy blood cells. Recovery. After a BMT, it takes time for the new stem cells to establish themselves in the bone marrow and begin producing blood cells. Patients typically stay in the hospital for a few weeks while their immune system recovers. Risks and complications. BMTs are complex procedures with potential risks and complications, including infection. Because the patient's immune system is suppressed, they are at risk of infection. Graft versus host disease, GVHD. In allogeneic transplants, the donor's immune cells may attack the patient's tissues. Rejection. The donor's cells may be rejected by the patient's body. Success rates. The success rate of BMTs varies depending on the underlying condition and the type of transplant. In general, transplants for non-cancerous diseases have higher success rates.